Efficiency in counseling sessions is crucial. Overlooking any point can result in the omission of key counseling elements. Therefore, a counseling organizer exists to ensure all necessary points are covered. The organizer for counseling is structured into three main segments. The first part involves the introduction, followed by the second part, which entails gathering patient information. This includes gathering a concise medical history from parents, exploring their views on vaccination, and addressing any concern they may have. The last part centers on providing information to the parents. This includes explanation of relevant details and concluding remarks. The introduction offers a chance to establish rapport with the parents and to create a favorable impression on the examiner. Initiate by greeting the parents. Introduce yourself. Ask the reason of visit, consent, and confidentiality statement. We can greet parents like this. Good morning, Mr. and Mrs. Smith. I am Dr. S, one of the attending physicians today. What brings you in today? Before we talk about the immunization, I'd like to ask a few questions to assess the overall health of your child. If there is a need, confidentiality statement would be like this. The discussion we are having today will remain confidential unless mandated by law. To understand their concern better, we can inquire by asking questions like these. What do you know about immunization? Have you received vaccinations? Have you encountered any negative experience related to the vaccination? What is the reason for this concern at the moment? Collecting a concise medical history from the parents include birth history, immunization, nutrition, development, environment, and other relevant conditions. Birth history is gathered to assess the overall health of a child, and we can start by asking the history of pregnancy when mother was pregnant with the baby. And we can ask, was your pregnancy planned? Throughout the pregnancy, did you experience any illness or condition? Was your baby born at full term or premature? Was it vaginal delivery or C-section? If it was C-section, could you share the reason behind that? Were there any complications or abnormalities? Did your baby cry immediately after birth? Did he require any special attention? When providing immunization counseling, it's beneficial to ask about any previous immunization history. And we can ask, are your baby's vaccinations current? If the answer is yes, when was the most recent vaccination? If the answer is no, is there any specific reason for that? Gathering a nutritional history is essential to assess the overall well-being of the baby and to help identify any signs of neglect or abuse. We can inquire about weight by asking, what is your baby's weight today? What was his weight at birth? The question related to height would be, do you have information about his height and are there any concerns regarding it? We can ask about diet. What do you feed your baby? Assist developmental milestone by asking age-appropriate questions such as, if a child is 6 months old, we can ask, can he sit without any support? Does he exhibit signs of stranger anxiety? Inquire about environmental factors to rule out abuse or neglect. How do you feel about your new role as a mother? Could you share who you live with and the dynamics of your household? What is your financial support system like? To determine if a child is a suitable candidate for vaccination, ask the following questions. Has your child experienced any illness, fever, or flu-like symptoms recently? Has your child been diagnosed with any neurological disease? Have both your child and you been screened for HIV? Is there any potential risk for HIV transmission? Does your child have any known allergies? To ask about parents' concern is very important because this gives us clue that there is a need to discuss this topic in detail. For example, parents might voice their concern in this way: why should I vaccinate my healthy baby when I have heard there can be a side effect? This indicates the need to emphasize side effects during counseling. The final stage of counseling session involves providing an explanation to the parents, and this includes the mechanism of action of vaccines, their benefits, their side effects, if there are any contraindications, and to make a plan. Start the explanation by describing how vaccine works and the mechanism of action, and we can describe this in this way. Immunization is the use of vaccines to make a person immune to specific diseases. A vaccine is a substance that trains the immune system to fight a disease without causing illness itself. It contains weakened or inactivated germs, prompting the body to develop a defense for future protection against the disease. We can explain benefits like this. Vaccination provides essential benefits by preventing the spread of infectious diseases, reducing illness and its severity. It contributes to community immunity, protecting vulnerable individuals who cannot receive vaccines. Vaccinated individuals are less likely to develop serious complications, leading to lower healthcare costs and improved overall public health. Vaccines are usually safe and have been instrumental in saving many lives. However, similar to any medical treatment, they may come with side effects. These can range from minor problems like pain, redness, and swelling at the site of injection to the possibility of fever, which can be addressed with pediatric Tylenol. In rare instances, more serious side effects like prolonged crying, seizures, or temporary floppiness in a child may occur, requiring immediate medical attention. Additionally, though exceedingly uncommon, severe allergic reactions may happen, which is why we observe children for 20 minutes after vaccination. If there is a question about the link of vaccines with autism, then the response would be: misinformation about a connection between vaccines and autism stems from a study conducted years ago, which initially suggested a link with the measles, mumps, rubella vaccine. However, extensive international research involving many countries and children has clearly shown that there is no such connection. The apparent correlation between the age when autism symptoms are observed and the timing of MMR vaccine administration is entirely unrelated. If there are any relevant contraindications, it is essential to have a discussion about them. Some of the examples of contraindications are severe allergic reactions such as anaphylaxis, moderate to severe illness, weakened immune system, known vaccine component allergy, previous vaccine reaction. Vaccinations typically begin around 8 weeks of age, with children receiving vaccines through either shots or oral doses at specific intervals. After getting vaccinated, the child may be briefly monitored for immediate reactions. It's crucial to maintain a vaccination record and ensure timely booster shots in accordance with the vaccination schedule plan. There is no need to worry about remembering the vaccination schedule because I will give you a schedule for the required vaccinations to follow with your family doctor. Conclusion remarks would be: I believe I've addressed your questions and I hope you now have a better understanding of vaccinations. If you have any more thoughts or concerns you'd like to discuss, please do not hesitate to bring them up. Thanks for watching. Do not forget to like and subscribe.